Hi, my name is Wangdavo Luka, and I welcome you to this episode of Health Content where I will talk about the use of sugar to treat wounds. Using sugar to heal wounds has been an old-time tradition in some climes and cultures and traditions. A Zimbabwean-born nurse brought this idea to his practice in the UK. Back then in Zimbabwe, they are used to dressing their wounds with sugar in an informal setting, and it has been working. So when he went to the UK and he realized that it's not being done in the hospital, he was surprised, and therefore he decides to introduce this into his practice where he treats some of his patients using sugar to dress their wounds, and he recorded some success.
I think it was the BBC West Midlands. It was you, David, who actually helped achieve all this. And I remember telling you that I grew up with a dad who didn't have formal education, and he was using this sugar. Now we have these thousands of people with formal education, scientific knowledge, whom we can show, and they can take this forward.
Various clinical trials were carried out in various hospitals in Britain, which showed success with the use of sugar to treat wound. Sugar does work to treat wound by creating a dry environment whereby the bacteria is not able to thrive and reproduce. So it is very essential for the wound to be dry, because if it's not dry, end up creating a block, which has a theoretical chances of breeding bacteria. Now, if sugar can heal wounds, then why are diabetics having wounds that does not heal easily? The thing with diabetics is that the sugar level in their blood is high, and high blood sugar level that is not properly treated or poorly controlled is associated with quite a variety of conditions which can impede wound healing. Some of that level can lead to weak immune system. It can lead to poor blood circulation in the peripheral circulatory system, like the limbs. It can also lead to nerve damage, a condition known as diabetic neuropathy. So these things all contribute to poor wound healing in diabetics. However, using sugar to treat wound does not lead to high blood sugar level, and therefore it cannot be said that using sugar to treat wound will impede the healing of the wound. Rather, it has shown success in even diabetics, even those who antibiotics has been proven to not work. Those that had wounds that resistant to antibiotics, like a very large necrotizing fasciitis that does not respond to antibiotics, it has been proven that sugar has come to the rescue of some of these patients that had an ulcer where they thought they would never heal from it. In comparison to sugar is the use of honey. Honey has been more clinically adopted as a means of wound dressing than sugar. However, they both work. Clinical trials were carried out, and honey has shown a little bit more superiority than sugar, but the fact still remains that sugar does work.